Good morning.
Good morning, Josh. How are you?
I'm doing great. Good to see
Good.
you.
How are you today?
Doing just fine. Doing just fine.
Yes, I am.
Glad to hear it. So it looks like we're in business.
Yep.
Okay, and I'm don't want to rush us to start, but I'm good whenever you are.
All right. I'll follow your lead. How's that, Josh?
Okay. All right. I will basically we're recording now, but we're not official. Once you hear the theme music, we'll be official and ready for broadcast.
Okay.
Okay, so stay tuned for that.
Yep.
Apparently.
Attended council hearings in person. You've tuned in to our televised proceedings on Channel 13. Now, you have the chance to listen to us on the radio as we demystify the work of the people who do it. This is not a council hearing. This is Hearing the Council with your host, Josh Gibson.
Thank you, deep-voiced person with a funky back. Indeed, this is not a council hearing. This is Hearing the Council. You can't have a government without a council, so you can't have a government radio station without a council show. This is it. I'm Josh Gibson, Director of Communications from the council. You may also know me from social media as at Council of DC. And of course, you know me as the host of this show. And today we are very happy and proud to welcome back Ward 7 Council Member Vince Gray. Thank you so much for being with us, Council Member.
Thank you, Josh. I appreciate so much. You've had me on quite a bit, and I really am delighted that you've opened the door of opportunity for us to be able to continue to convey information to people about what's going on, in the city, but across the entire city and across all the areas where we touch, including healthcare and education and the other hugely important issues. So I just want to say thanks for you continuing to be able to make people accessible to us about what we're doing on their behalf.
Well, first of all, I appreciate it. Thank you very much. The goal really is we don't want it to be gotcha, like it can be on broadcast radio sometime
Sure.
where you're getting interrupted every 5 seconds. But we also don't want it to be just straight the company line,
Sure.
Tell me about your excellent accomplishments. We don't
Yeah.
want it to go that direction either. So the idea is to kind of just have a worthwhile interaction, hopefully teach people some stuff and maybe dig a little deeper since we have a half hour and not a little 5-minute radio interview.
Sure.
So topic wise, it seems like we're going to be talking about your budget priorities and committee priorities for the months to come. So why don't we start with the budget priorities, just because, the mayor will finally be dropping her budget May 27th. That was
right around the corner now, isn't it?
Yeah, well, I mean, it's been moved a couple times because the idea was always to incorporate the federal COVID money in the budget so the council
Right.
would get a realistic look at what the actual budget will be. So anyway, we're getting the budget on the 27th. So what were your asks to the mayor for inclusion and which, if any, do you have a sense will make it in?
Well, we're very hopeful, Josh, as you know, because we've talked about it before, the importance of early childhood education for our young people, our young families in the District of Columbia. So one of the things that I did was I issued a statement just a matter of a couple of weeks ago, less now, touting the work that President Biden is doing as a part of his American Families Plan, which is a 1.8 trillion, a lot of money, 1.8 trillion spending proposal to address a range of social issues. And one of the issues that the president is proposing to address is early childhood education, and specifically, we're talking about pre-kindergarten. Josh, you may remember, because I think we've talked about it before, we may not have, but we actually started, we were the first in the nation to have a pre-kindergarten, universal pre-kindergarten program across the entire District of Columbia. When we established this, I was the council chair when we started that effort. What we did was we made sure that every one of our very youngest children, those who are 3 and 4 years old, had a chance to go to school. And it was important to me to be able to make sure that people understood that they were going to school. This wasn't preschool. This wasn't any derivative of that. It was absolutely going to school every day. And what a phenomenal experience we've had with serving children who are that young, and watching them develop, watching their social skills, their academic skills, their emotional skills develop as people. And so I'm really applauding President Biden for what he's doing. I want to say, way to go, President Biden. You wish you'd come along just a few years before now. But in any event, he is with us now, and I'm extremely happy with what he's doing to be able to get pre-kindergarten now in the households of all of our very, very young children in the District of Columbia. I think we've had a program now. This will probably be our 9th year that we've established this, and we put a lot of money into it, a lot of effort into it to try to ensure that our children would be able to flourish as they move into an increasingly competitive world. I think we have a duty to make sure that our families have these opportunities, and that our children have a chance to be educated in the most effective ways. What Biden is proposing to do is that he's also going to put money, in addition to that, he's going to put money into early education as well. $225 billion to try to make early childhood education much more affordable than it otherwise would be. We have a lot of people who do this work, and they really work for really poor wages. They're not paid well at all. And so with the president's plan, this will allow us to pay people better wages than they've been getting to be able to provide childcare. This will no one would be paid. They wouldn't be paid anything. They wouldn't be paid more than 7% of their income for childcare, which is really a huge step forward, Josh. It is getting us to a point where we can make people who want to work in the early childhood field, makes it much more affordable than it otherwise would, because we've had far too many people, who wanted to work in childcare, and then the opportunities didn't present themselves, or they just weren't able to work at the low wages that were being paid to people. So I'm excited about what the president is doing. There's going to be a lot of families who will be excited about this. And I'm just looking forward to it. And I'm hoping that we will get enough money to be able to put into early childhood education, through the additional dollars that will be available to us. And so I'm going to calling on our council colleagues to recognize the importance of this. I really think, Josh, I think we've made the case over time for the importance. We just haven't had the money then to be able to go more deeply than I think we can at this point. In fact, one of the things that we're looking to do is to invest more money in BirthtoThree, because that's legislation that I've been able to get passed since I've been back on the council, and BirthtoThree
That's
means
where
that,
that's where the funding gap is, right? On the
yes,
BirthtoThree
that's
side.
right. That's exactly right, Josh. That's exactly right. We just haven't had all the money that we need, all the money we deserve to be able to support these very, very young children. You know, if you look at the brain development, for example, of so many of our children, so much of brain development occurs before a child, before a child is at even the higher developmental levels. So we're looking to be able to provide more services to the very youngest children so that we will have, I want to be able to say that we will have a program that goes from birth all the way through 4 and 5, and of course, up into the higher ages of education as well. So that's going to be hugely important to me. And I think it's going to be hugely important to so many of our families in the District of Columbia. So this is a seminal moment for us. And I'm really excited about it and what we can do to be able to make these services available to our very, very youngest children.
Now, I'm not quizzing you on an exact dollar amount, but do you know roughly what the gap is, what the hole is that needs to be filled in order for us to subsidize BirthtoThree like we do 4 and 5?
It's going to be substantial. It could cost us another $100 million, maybe another $200 million. But if we get the kind of support that we think we deserve, I think we can do it. And I think we will. I think people will be so happy. I work with so many early educators who want to do more work than what they've done up to now. So this will open the door for more early educators to be able to do the work that they've been trained to do, the work that they want to do, and the work that they want to do because they want to work with the very youngest of our kids. You know, I've worked, Josh, with a number of people who are early educators themselves. People like Carrie Thornhill, who has been just a wonderful, wonderful early educator. Barbara Kamara, Maurice Sykes. These are people who have spent their lives doing this kind of work. And I know they're extremely excited about the opportunities that we may have, depending, of course, on what we get, but it depends so much on recognizing that we can open these doors to children in ways that just haven't been opened before. I know that there've got to be, people around the country, because I worked with mayors when I was a mayor. I worked with mayors. I saw Blasio in New York, who wanted to establish a universal pre-kindergarten program. The mayor of Chicago at the time wanted to do the same thing. But we're the only ones. I know of no other state. We're going to be a state one day, Josh.
Hell yeah.
Yes. But I know of no other state that's actually doing this. And now we have an opportunity to expand that and reach more children, more families than we otherwise would reach. So I'm ecstatic about it. I mean, if I sound effusive, it's because I am.
Yeah. Have you gotten, I know it's still early, but have you gotten any early signals from the mayor or from your colleagues how likely it is that we'll be able to close that gap this year?
No, I have not. I mean, I think there's, I don't know if anybody doesn't support it, put it this way. Of course, a lot of times people can support things, but then they don't have the wherewithal to be able to make it happen. So I'm hopeful that once we get the, the indication of how we're going to move forward, and I hope that the mayor will support dollars being invested in this way. I think we're going to have a wonderful opportunity to serve kids in our DC public schools and in our charter schools as well. We have universal pre-kindergarten now in our charter schools and our DC public schools as well. So what this will do is allow us to continue to build on our universal pre-kindergarten efforts, but it really will too, Josh, work to augment the work that we're trying to do with BirthtoThree. We know it's going to cost more than what we have now. We've gotten some federal money to be able to support BirthtoThree up to now. But prior to that, we haven't had sufficient money to be able to move to the next level. So the opportunity presents itself, I think, Josh, to be able to do more for our very youngest of children and their young families. Because just think about it, that so many of these children are, in families where the parents, the families are very young themselves and are looking for the kind of support the family should have to be able to raise their kids in a way that we couldn't do this heretofore. So I'm really excited about that. And in any event,
So
that's-
what other budget priorities have you let the mayor or the chairman know that you're pushing hard for this cycle?
well, one of them, thank you, Josh. I appreciate that question. One of them is, what are we going to do about these food deserts in the District of Columbia? 75% of the food deserts in the District of Columbia actually exist in wards 7 and 8. And what's really ironic is we have only so many. I mean, there's so many food options that just don't exist the way they should exist. Again, we have 75% of the food deserts in the District of Columbia that exist. And when you think about the following, and it's almost shameful to have to say this, but you can go to some areas of the District of Columbia where in a ward, there are as many as 10 full-service grocery stores that exist. What we have, for example, in Ward 7, we have 3 full-service grocery stores, and we have another one coming with the Lidl that's going to be open in Skyland. And then we have 1 full-service grocery store in Ward 8. That's just unconscionable that we have that many situations that exist where people don't even get the grocery services that they need and deserve because the services just aren't available. In wards 7 and 8 collectively, we have 160,000 residents. And that's a lot of people, Josh, that don't get a full service grocery store available to them at this point. And I'm hopeful that we will be able to address that with this budget. I have legislation that you probably, because I think we've talked about it before, but where we had PAYGO money, additional money that's in the budget that got dropped back because of the COVID and the money we had to spend on COVID. But we've got opportunities now to be able to, I think, put additional money in the hands of these wards that will allow additional services, full service grocery services to be provided to people who otherwise wouldn't have those services available to them. So I'm hopeful that in addition to what we do with early childhood education, we'll also do something important for ridding the city of these food deserts that exist as well.
And how is the money, where does the money go in that case? Are they just incentives to grocers to come to the ward, or are they tax breaks, or what? Why does it cost money, and what does the money do?
Well, what we'll be able to do, based on the legislation that I worked on, I'm happy and appreciate the work of my council colleagues to support this. But what this is doing is allowing grants to be made available to grocers, and that the city would actually build the buildings that would exist for grocers in the District of Columbia. So we would invest in the building of the buildings, and these grocers would come forward and indicate they want to provide full service grocery stores. And we would make the dollars available to build the buildings and then work with them to actually open the grocery stores that are needed. Again, Josh, when you talk about some areas having as many as 10 full-service grocery stores, it's just unconscionable. And then you talk about Ward 7 that has 2, and Ward 8 that has 1. And then Lidl, which is a new grocery store coming to this area, coming to Ward 7. But we'll have, as a result of that, we'll have 1 Lidl coming to Skyland Town Center, and then you've got 1 Giant in Ward 8. That's not acceptable at all, by no means.
Now, I will say that I know there's been a lot of hope on Skyland for a long time, but I think maybe some folks were thinking, oh, it'll fill a bit of the retail and restaurant gap for Ward 7. But I think with the latest news coming out about who's ending up there, it sounds like it's going to be a regional destination. I mean, it has some really appealing brands and DC centric businesses coming there, and I really think it's going to draw people into the ward, not just residents of the ward.
I actually think you're right, and I'm excited about the opportunity. Josh, there's a Chase Bank that just opened in Skyland because of some of the efforts now moving forward quickly. We also have a Starbucks, the first ever drive-through Starbucks is coming to Skyland. I don't think we've ever had one in the city, a drive-through. So we're going to have that in Skyland. So just think about that. Think about the new opportunities that are going to exist. There will be additional food opportunities. I think we may have a Chipotle coming there as well. So that, an area of the city where I live, isn't that exciting to think about where we've got now new opportunities where doors are opening to people to be able to be served in ways that they hadn't before. I've had so many people who are so excited who talk when you tell them about the drive-through Starbucks.
Yeah, I mean they'll break even just on the council members.
That's right. That's right. Just on me.
And also, I mean, if we'll kind of see what happens, but we've talked before on the show about the Logan Circle Whole Foods or Fresh Fields first open.
Yes. Yes.
And that the corporate may have felt like they were sticking their neck out, but once that opened and it went on to be one of the highest yielding stores in the entire country, I'll be curious to see once these folks that are opening in Skyland are open, what their numbers look like. And I think there'd be a decent chance that the sort of less courageous business owners might, see it's not such a risk after all and follow the leader into Ward 7.
Well, I certainly hope you're right about that. One of the biggest disappointments for me was as mayor, we had reached an agreement with Walmart. Walmart was supposed to open 2 stores. They were supposed to open 5 in the city. They opened in down on 8th Street near the government printing office. They were to open in Riggs Park. They were to open on Georgia Avenue. And then they were supposed to open, Josh, 2 stores in Ward 7. One was supposed to be in Skyland, and the other was supposed to be on East Capitol Street, very close to where so many people live, so much public housing over there. And what was hugely upsetting and disappointing to me was to see what they did. They just showed up one day and said, we're canceling the lease and we're not going to open either one of those Walmarts in Ward 7. Now, what has happened is because we had done eminent domain to be able to get Skyland done. But in any event, we have the Lidl that's coming now to Skyland, and the Lidl and the developers, Chris Smith and Gary Rappaport, they've done a great job in helping to move forward with those efforts. But the Lidl is coming to where the Skyland Walmart was supposed to be, and then the other one is just nothing. It's just a vacant piece of land that's sitting there at this point, and it's really upsetting to see that have happened, and to see people just with impunity walk away with no And you can't tell me they wouldn't have made money. I am absolutely convinced that both those Walmarts would have made money. There's no question Lidl is going to be making money because they're right across the street from where the Safeway is at this point. And then you've got the rent still being paid by Walmart because they have a lease. They are now paying the rent every month. But, you know, when I talk to people, the question they ask is, what the heck do we want with a rent receipt? Rent receipt doesn't do us any good. I can't eat a rent receipt. That's absolutely right. You can't eat a rent receipt. And we want the services, we want the full service grocery services that were to be brought by the Walmart locating there. So, you know, if we're lucky, we'll get somebody who will come along now. Maybe Walmart will come back, who knows? But will come along and work with us to be able to create the kind of full service grocery store opportunities that we need desperately. I mean, when you think about how many people again, just do the math. 160,000 people who live collectively in Ward 7 and Ward 8. That's a lot of people in one ward, Josh. And you know, we believe that there's an opportunity. It goes back to what you were talking about before. Just in talking about the sheer numbers of people who are being attracted to areas of Ward 7 in particular, who I know will patronize those grocery stores once they're built. I don't have any doubt that if Walmart had gone ahead and built the stores that we know should have been built, that it would, I won't say it'd be overrun. I would say they would be highly patronized with the number of people who would shop in those stores. So.
And I mean, admittedly, city folk might shop a little differently than suburban folk, you know, that we may be walking distance or a short bus ride from a grocery store. So we might go more often and spend less per trip, you know? So, I mean, of course, and the product mix we want is different, but I think a smart business would be able to adjust to that, you know, tailor their offerings and maybe not look at like, oh, per shopping trip, this store doesn't look like they're going to sell as much. They don't get that we go 2 or 3 times a week, maybe in the grocery store. Whereas in the suburb, they might fill the SUV and go home and not come back for 2 weeks. You know, you have to take that kind of stuff into account. It seems like a shame they didn't. And, you know, past is prologue, when Whole Foods did take that chance, it paid out majorly for them. And that was a neighborhood that, at least at the time, seemed risky from a business standpoint. So,
no, so it's a great point. And I'll tell you something, Josh. I don't think there'll be much of a risk involved in grocers coming to Ward 7 or even coming to Ward 8 with the opportunities that exist there as well. So I'm excited about the chance taking, for want of a better way of putting it, that will occur. And I think if we can get some of these grocers attracted, especially to Ward 7, we will have a major opportunity to be able to move forward. And I'd love to come back on the show when we get our additional grocers that are willing to come to Ward 7.
Now, with the time left to us, let's pivot from council priorities to health committee priorities.
Yeah.
And let's talk a little bit about the current news about the status of UMC, of United Medical Center. The council took a pretty impactful vote at its most recent meeting to put a funding cap, to maintain a funding cap on spending at UMC and essentially to trigger creation of a control board. So where do things stand on this? Is this decision going to stand?
Well, I think it probably is at this stage. You know, we initially tried to turn it around to get folks to see. We had a vote of 7-6. We had 7 votes in favor of doing what we were trying to do, 6 votes against. But we needed 9 votes in order to have sufficient numbers to be able to to move forward with what we were seeking to do. In any event, the control board has been triggered. And what you'll have now is not want to say complete replacement, but a substantial replacement of the board of trustees for United Medical Center. Some of those folks will, will include people like Wayne Turnage, who's done a great job as the deputy mayor for Health and Human Services. We've got Angel Jacob, who is she's not the chief financial officer, but she's the chief of staff for the chief financial officer at this point. So she'll be there. There will be others who will be there. Robert Bob, who used to be the city administrator, excuse me, will be on the control board. So they will have the responsibility with the operator for moving forward with the effort to manage the dollars that we're investing at the United Medical Center. One of the things I should have mentioned, Josh, and I appreciate you raising this issue, but we are moving along now with creating a new healthcare system on the east end of the District of Columbia. We will have we're going to build a brand new hospital, which will replace the United Medical Center, which is a really old facility at this stage. It was established back in, I think it was 1965, 1966, way before any of us were doing this, that's for sure. So that's going to be, the new hospital will be built. There will also be an ambulatory care center as well. An ambulatory care center will be places where people can go to be served and go home soon thereafter. They won't have to be admitted to a hospital, which they could do if necessary, but we'll have the new hospital, new ambulatory care center that is being developed. And for the first time ever, Josh, we're going to have urgent care centers. We have never had an urgent care center in Ward 7, and we've never had one in Ward 8 in the entire history of the city, which is unbelievable that we haven't even had those kinds of services available to people. In fact, if we're lucky, we'll not only have one in Ward 7, but we may have two coming to Ward 7. MBI is coming with, they're finishing now, the work on their certificate of need, which is required by everybody to be able to get to provide such services in the District of Columbia. So we're excited about that. This is going to do something that's never been done in the history of the District of Columbia. And I am so excited. I've been working on it since I was the mayor to be able to get a new hospital done. And then, of course, working with Rashad Young, working with Wayne Turnage, working with Ben Stutz, who worked with the city administrator, working with them, we've been able to get to this point. Josh, we're investing $383.7 million in the building of a brand new healthcare system. And frankly, and I don't mean to go back over territory we've already talked about, but when you talk about food deserts and you talk about food, man, that is one of the most important ways to address healthcare for people. To get the food deserts solved and to provide a real healthcare system that just hasn't existed heretofore. With to use the numbers I used earlier, with 160,000 people living in Ward 7 and 8 combined, that's a lot of people who, if we get the food issues solved and create a real healthcare system, which just doesn't exist at this point, we will be really on a pathway to be able to create just the kind of place that people want to see in Ward 7 and Ward 8 of the District of Columbia. Again, I don't want to recite those numbers again, but those are huge numbers that we talked about.
But what isn't one of the major challenges of public policy that there's sort of a perverse incentive system that public officials love new things. Metro loves to expand and open new stations. obviously the new hospital is a landmark, but a lot of times that seems to come at the expense of not keeping up with the boring things. You know, Metro's maintenance of its existing system was not where it needed to be. And we're seeing that, you know, we'll get the new hospital in a couple of years, but we need to get to a couple of years from now.
Yeah.
And it's really difficult. It takes a lot of self-discipline because there's no ribbon cutting for keeping the old thing running on fumes until you can transition to the new thing.
Right.
How do you I don't know, how do you think we can get public officials to crack down on themselves a bit more and fund the vegetables, the day-to-day, and not get drawn in by the glamour of the new?
No, I appreciate it. That's a great question. And what I'm hopeful is I think people will realize that we now have, for the first time ever, a real opportunity to create a real healthcare system for folks with real grocery stores available to people. So the new hospital, when it opens, will serve, will have 136 beds in the new hospital. But we're building it larger so that as presumably the demand is created, we can go up to 198 beds to be served in the new hospital. And then with the ambulatory care center also, Josh, there will be people who can be served that won't even be able to have to stay overnight in the hospital. So I'm hopeful that people will recognize that we have a real opportunity to create something that just doesn't exist now. You mentioned you're using Metro as an example, which is a great example. But it's almost as if we've got to create the services and the Metro at the same time, because there are so many needs that exist. We have so many people who want to get from one place to the other place, and Metro will help them get there. But hopefully, the healthcare services that we'll have available to people will help them get to a point too where they just don't have to worry about trying to find transportation like Metro to get to another place in the city. One of the things I should have mentioned is that the hospital is going to be run by George Washington University. They stepped up. We're working with Ms. Russo, who is the CEO for George Washington University, and we're now working to try to get to another place to get those services being provided coming across town, and people won't have to catch a bus or catch an Uber or whatever they may catch to go to some place not even in their own neighborhood. So that's one of the beauties of this too, and that is being able to get to a point where those services are being provided conveniently to people, because right now there is no convenience. The United Medical Center, which served its purpose during time, will be gone after 2 years from now. When it goes, we are ready to be able to open the door to the new hospital, open the door to the new ambulatory care center, and frankly, we will be able to open the door to the urgent care centers. We should be able to have the first urgent care center finished by the end of this calendar year. And then Ward 7 one, we hope that will be done within a matter of 18 to 24 months as well. And we'll have the new urgent care centers open as well. So again, it isn't as if we've got to wait the full 2 years for the new hospital to get finished, or we got to wait full 2 years, which would be 2 years anyway, but to wait a full length of time for a new ambulatory care center, that these urgent care centers will be available to people much more quickly than otherwise would be the case.
And folks, if for any folks who think that being a council member is easy, I did not envy the vote on the United Medical Center
Right.
at the meeting, because it's a lose-lose. You know, you vote against the increased funding and to stop the control board. You know, you're supporting healthcare east of the river, which is critical. You're supporting the labor force there, which is critical. But there has been, you know, a ton of spending over there, and the results aren't always obvious. But then conversely, you know, you shut down the funding and you can seem fiscally astute, but maybe insensitive to the needs of the patients and the staff. So there was really no good vote there. And it's a sort of a lose-lose situation, unfortunately.
Well, it is, and one of the things I guess I should point out too, Josh, is that with the COVID, the numbers have fallen off tremendously at UMC. There just are not the numbers that, you know, have come there in the past. And the revenue, of course, has dropped off tremendously too. That's one of the problems that we've had trying to keep the doors open at the current UMC, because the numbers just aren't there. The numbers of patients that have been there historically, not there. The other thing that we did too is, you know, we have an operator in the interim. Mazars is the name of the operator, and they, you know, they hired. They have an operator, you know, CEO of the hospital, and they dismissed CEO because she was actually spending money for contractual services, and there were no contracts that had been put in place. So that was just hugely irresponsible. And so I'm not losing any tears over this person having been dismissed, I'll tell you. So we're just hopeful as we get GW in there to operate the new hospital that we're going to have a much more responsible approach to how healthcare services can be provided. And when you go down to GW down in Foggy Bottom, you see a well-run hospital. And that's exactly what we're hoping will happen when the new hospital opens on the grounds of St. Elizabeth's. It'll be close to the communities that will be served, be close to Port 7, close to 8. And by the way, I should have mentioned this too, that we've got specialty healthcare services that are going to be developed at Skyland. There'll be 14 or 15 new special services that will be developed at Skyland, and people who have particular needs to be addressed, they will be able to get those services at the new medical building that's being developed at Skyland. And by the way, I should mention this, we've got Whitman Walker, which has done a great work in the city historically. They're developing a healthcare system on the east end of the city. They're going to develop actually medical buildings on the grounds of St. Elizabeth's. And we hope, by the way, that Mayor will work with us to try to invest additional money in Whitman Walker to help them be able to complete the work that they're doing over there. Some will remember a former council member, Jim Graham, who was the CEO of Whitman Walker at one point, and did a phenomenal job of developing services with Whitman Walker. Max Robinson Center, which is located right now on Martin Luther King Avenue, that whole operation will be moving to the grounds of St. Elizabeth's, will be there in close juxtaposition to the new hospital, to the new ambulatory care center, and what a great complement that will be to the other services that we have that are being developed on the grounds of St. Elizabeth's, virtually as we speak.
Well, unfortunately, we're out of time. I have one more question for you.
Okay.
People who don't visit Ward 7 and Ward 8 don't realize how green it is. Lots of grass, lots of trees. Are you worried about the cicadas?
I'm worried about us being able to maintain our greenery. We have lots of Park Service land that exists in Ward 7 especially. And we are certainly very concerned about being able to maintain those services for people. And so I am concerned about that. And I think we're going to be able to maintain that. I'm looking forward to it. And I certainly, as one who's a real environmentalist, my colleague, Councilmember Che, is as well. And I look forward to working with her as we try to work hard to maintain the greenery for people in Ward 7.
But are you worried about the 17-year cicadas, the bug?
Yeah, boy, they're interesting, aren't they? Yeah, once every 17 years we get the cicadas, right? And what a lot of noise they make. You know, and then they disappear at a point, and they come back another 17 years later. So yes, we're worried about them. I'm worried about them. Worried about the damage that they can do to people and to the property. But once every 17 years, I think we can deal with it, Josh.
Yeah, it's like if you put that in a novel or in a TV show that there was this weird bug that came every 17 years, no one would believe it.
That's
but
right.
It's
That's right.
the reality. You know? It's too
It
strange
is a
to be fit.
reality. So absolutely. And you know, if I could just say one more thing, Josh, if you don't mind, that is,
Sure.
you know, we are working hard to, you know, with our kids having been out of school, especially on a face-to-face basis, having been out of school for so long, we know that we got to make some investments in school-based mental health services. And I've done that previously, and I'm looking forward to being able to do that again, hopefully with the mayor's support, to be able to make those kinds of investments. So we will look forward to doing that, to invest additional money in the school-based mental health program. We have a relatively new director. She's been there now, she'll be just about 2 years. Dr. Barbara Bazran, who is the director of the Department of Behavioral Health, which is an entity that I started as the mayor. We amalgamated the Department of Mental Health and the Substance Abuse Services into one, which is an increasingly common approach for providing such services around the nation. So I'm looking forward to that support, hopefully, and to be able to get more services available to our young people as they and their families grapple with behavioral health service needs that exist in the city. And so I hopefully we can come back during the budget period, Josh, and talk more about those opportunities. We know that we've got work to do around violent crime. There's increasingly large numbers of people who are engaged in violent crime. You know, we got the violence interrupters, the neighborhood safety and engagement services. We got the Cure the Street program, which was actually started by Carl Racine. And then we got more violence interrupter programs too that we know we need to continue to support. And I'll close on this, Josh, because I know your time is running short. But we've got we need more library services in Ward 7. We're looking to build a new library in Deanwood. The Deanwood Library is very undersized at this point. It's located in the Deanwood Community Center, and we need a full service library. And I'm asking for support to be able to get that done as well. And also the good people of River Terrace have been waiting a long time for a recreation center. River Terrace is really somewhat isolated. There are lots of needs that exist there of young people. And of course, River Terrace is right there on the Anacostia River. It's a great location, but we want to be able to provide the support that's necessary to make sure that the good people of River Terrace get the services that they desperately need. And we can create the recreation center that they richly deserve. So we're also.
So it sounds like we have more than enough for an entire show.
Yep.
Just in terms of the other budget priorities.
Absolutely. Well, we got the streetcar coming to Ward 7 also. It's been on 8th Street heretofore. And what we're looking for is expanding it now all the way out to the Benning Road Metro Station. And what a wonderful addition that will be. I've been to Portland where they have a well-developed streetcar system. And we're looking to be able to do the same thing now, to take it from the Fletcher Johnson area, which is going to be redeveloped. I'm excited about that. And expand it now all the way to the Benning Road Metro station. So stay tuned, Josh. We got a lot of work going on.
Okay, maybe we'll do some transportation on the next show as well.
Absolutely, that would be wonderful.
But anyway, thank you so much for joining us, council member. Very appreciative. And thank you, listeners. Listeners, remember, subscribe to our podcast. It's on SoundCloud, Apple Podcasts, wherever you get your podcasts. Thanks again for joining us. Tune in next time. We're on DC Radio at 96.3 FM, HD4, dcradio.gov. I'm Josh Gibson. This is not a council hearing. This is Hearing the Council. Thanks again, council member. Good to see you.
Thank you, Josh. I appreciate everything you do. And I know our listeners do as well.
Happy to do it. Happy
Thank
to
you.
do it. Thank you. Be safe. Be well.
Thank you.
Okay. Bye-bye.
See ya.